Fitch has a stable outlook for U.S. healthcare in 2013, but our stable outlook does incorporate the effects of some key operating risks that we see for the sector during the year. These are going to be most important in the large developed markets for healthcare utilization, including the U.S. and Europe. So in the U.S., companies in the healthcare sector are contending with the challenges of the fiscal cliff and related federal deficit control measures, which could result in lower payments to the industry. In the Eurozone, you have ongoing fiscal stress, and you have many countries that have implemented reforms that are resulting in lower payments to the healthcare industry. I would say, though, that those operating challenges are offset by some positive factors that we see for 2013 as well. These include faster growth in emerging markets. It would also include positive demographic trends in the developed markets for healthcare utilization, which are going to support a baseline level of demand growth in those markets. And then the last thing I would note is that companies have been very successful to date in offsetting the implications of weak top-line growth on profitability by being very successful in cost-saving agendas. We're really right now in the midst of the global branded drug patent cliff, which peaked in 2012, but we're going to feel the continuing effects of it through 2014. One thing we do note, however, is that we think that pharmaceutical companies do have a lot of avenues to look to in order to offset the pressure that they're seeing on top-line growth as drugs come off patent. And we expect companies to use these opportunities to their advantage in 2013. These would include things like diversification of business outside of traditional pharmaceutical products into less risky products and business segments. And then also geographic expansion into faster growing emerging markets. We particularly expect to see that through bolt-on M&A activity. And then the final note I would make about the U.S. pharmaceutical company ratings is that we generally do expect ratings to remain high in the single A category or above, despite the pressure these companies are under. And that's really because of the excellent liquidity profiles of these companies, which is highlighted by their solid and robust free cash flow profiles. Fitch thinks that the Affordable Care Act is going to be a positive tailwind to growth for the healthcare industry in 2014. And that's because of both a higher rate of organic healthcare utilization in the U.S., as well as lower levels of uncompensated care, which are going to be most helpful for general acute care hospital providers. The thing is that the magnitude of the positive effects in 2014 are going to depend on a couple of items that we just don't have a lot of clarity on at the moment. We will, however, have better visibility on some of these items by the middle of 2013. And these include the structure of the state health insurance exchanges, as well as the eventual expansion of state Medicaid programs under the Affordable Care Act. Both of those items are going to be most important for healthcare providers. We would also note that there are a couple of elements of the Affordable Care Act that are going to impact the healthcare industry for the first time in 2013. These would include reimbursement reforms under Medicare, including the value-based purchasing program and the hospital readmissions penalty program. Both of those will impact healthcare providers, and they took effect for the first time on October 1st, 2012. Then we also have the 2.3% medical device excise tax, and this will begin impacting manufacturers of medical devices in the U.S. starting on January 1st, 2013. Fitch thinks that a key risk for the healthcare sector in 2013 are potential reforms to healthcare entitlement programs in the U.S., including Medicare and Medicaid. So we think that any potential compromise that's reached to reduce the size of the federal deficit is likely to involve changes to those programs because they make up such a large portion of federal spending. At this point, we think that large changes to the Medicaid program are probably relatively less likely. And this is because that program plays an integral role in the expansion of health insurance coverage for lower income Americans under the Affordable Care Act. So changes to the Medicare program are probably more likely in the near term, and those have the potential to be highly influential for the entire healthcare sector in the U.S.